Hello guys, so now we shall be discussing regarding the muscles of the upper limb. Okay, so first of all we shall classify the muscles of upper limb into 6 parts. First of all we shall classify the muscles of upper limb, guys. So what are the different muscles of upper limb? So let us say 1, we have got 2, we have got third group, we have got the fourth group, we have got the fifth as well as the sixth group of muscles. Now the first group of muscles are in the pectoral region. First group of muscles are in the pectoral region. Next group of muscles are in the back. After that we have got the scapular region. Scapular region. Next we have got the arm. Next we have got the forearm as well as hand. Okay. So the muscles of the upper limb are divided into pectoral region. We have got the back muscles. We have got the scapular muscles, we have got the muscles of the arm, we have got the muscles of the forearm as well as the muscles of the hand. Okay, first of all we shall be discussing mainly on the muscles of the pectoral region. What are the muscles of pectoral region? We shall cover all the clinical points, we shall cover all the muscles, everything we shall be discussing, which will be definitely useful for your exam point of view, right? Now when it comes to the pectoral muscles, simply remember this mnemonic 2P, 2S. So 2P and 2S. Okay, this is how you remember the pectoral region muscles. Now what are 2P? Obviously the 2Ps, they stand with the name pectoralis because it is a pectoral region muscles. So one is called as pectoralis major. Another one is called as pectoralis minor. Okay, pectoralis major as well as pectoralis minor. And 2S, what are the 2S? One is called as subclavius and the other one is called as serratus anterior. One is called as subclavius, another one is called as serratus anterior muscle. Serratus anterior muscle. And all of you remember, this is an MCQ that was previously asked regarding this serratus anterior. That serratus anterior is called as boxer's muscle. That is called as boxer's muscle. Okay, serratus anterior is called as a boxer's muscle. Keep this thing in mind, just print it in your mind. Okay, now when it comes to pectoralis major, one very important thing you need to know is that this entire muscle, whatever you can see right now, right, so this entire muscle here, this is called as your pectoralis major muscle. Okay, this entire muscle is called as the pectoralis major muscle. Okay, what is this called? This is called as your pectoralis major muscle. Okay, origin and insertion, you need not to know regarding the origins and insertions because in the upcoming next exam no one is going to ask you the origins and insertions, but you have to know the insertions of most important muscles. For example, you need not to know the origin of pectoralis major, but you have to know the insertion of pectoralis major. Now what is the insertion of pectoralis major, guys? I have told you previously, if you remember, I have told you previously that let us say this is your what? Humerus. So let us say this is your humerus like this, right? This is your humerus. And I have already told you that humerus has got 2 lips. This is called as a lateral lip. This is called as a medial lip. Okay. So this is called as your lateral lip of the humerus and this is called as your medial lip of the humerus. And I have also told you that the space between these 2 lips is called as intertubercular sulcus or bicipital groove, isn't it? The space between both of these lips, this is called as bicipital groove or intertubercular sulcus or bicipital groove. And I've already told you a mnemonic, a lady between 2 majors. A lady is in the center, 2 majors on either side. What does a lady in the center indicate? Lady in the center indicates what? It is the latissimus dorsi and 2 majors on either side. Now out of these 2 majors I have already told you, remember the mnemonic M, E and T, MET. Right? What does MET stand for? ME stands for medially. We have got a major with the name T. T stands for teres major. Teres major. These things I have talked previously in the lecture called humerus, right? So teres major. So one thing we are clear that in the medial lip we have got teres major. That is getting inserted here. But whereas in the lateral lip, then what muscle is left over? That is pectoralis major, right? So this pectoralis major is a muscle which is inserted to the lateral lip of bicipital groove. Lateral lip of bicipital groove. Keep this thing in mind. Okay. So one thing you need to know about the pectoralis major is that it is inserted to the lateral lip of bicipital groove. And second important thing you need to know is that pectoralis major has got three important functions. What are those three important functions? Is that pectoralis major is actually a famous muscle. It is actually a very famous muscle. Why? Because it does flexion. Okay, it does, A stands for pectoralis is a very famous muscle. Why? Because it does three actions. What are those three actions? F stands for flexion. F stands for flexion. A stands for adduction. A stands for adduction, and M stands for medial rotation. Medial rotation. So, if I ask you, flexion of arm, medial rotation of arm, and adduction of arm is done by which muscle? That is your famous muscle, that is pectoralis major. That is pectoralis major. Clear? These are the two important MCQs which you need to remember. So, this is one MCQ over here, and the other MCQ is it is attached to the lateral lip. Okay, this is another MCQ. Third MCQ is that all these muscles, the pectoral region muscles, they are located near the axillary region. This is your axilla. They are located in the axillary region here, right? So if someone asks you what is a key muscle, what is the most important muscle of the pectoral region, okay? So if someone asks you what is the key muscle of pectoral region, what is the key muscle of pectoral region, guys? Yes, the key muscle of pectoral region is pectoralis minor. Pectoralis minor. Why pectoralis minor is called as a key muscle in the pectoral region? Yes, that is very, very, very important. See guys, here we have got, let us say that this is the coracoid process. Let us say that this is the coracoid process of the scapula. Now from this coracoid process, we have got a muscle that is emerging out like this, right? So what is this muscle that is emerging out of this coracoid process, guys? This is called as a pectoralis minor muscle. What is this muscle? Yes, this muscle is called as a pectoralis minor muscle. Now we also have got an artery. Let me draw it with green color. We have also got an artery that is coming all the way down like this, right? So this is an artery that is passing all the way down, and at one point it is passing behind the pectoralis major, and the name of this artery is axillary artery. Axillary artery. So why pectoralis minor is called as a key muscle? It is because this pectoralis minor is dividing the axillary artery into three parts. Above the pectoralis minor, this is called as the first part. Behind the pectoralis minor, that is called as the second part. Below the pectoralis minor, that is called as the third part of axillary artery. That is the reason why, based upon this pectoralis muscle, the axillary artery is dividing into three parts, so you call it as the key muscle of the axilla. So we are done with the discussion of pectoralis major as well as pectoralis minor. Okay, now we shall discuss about subclavius. There is nothing much you need to know about the subclavius muscle because it is just located beneath the clavicle. Subclavius is a muscle which is located just beneath your clavicle. Okay, after the subclavius, we have got a very, very important muscle that is repeatedly asked in your examinations, that is serratus anterior, right? So you can look at this athlete, right? This is how the serratus anterior look here. These muscles, whatever you can see here, right, on either side, right, which are attached to the ribs here, these are called as serratus anterior muscle. This is called as serratus anterior. It has got a serrated margin, right? So that is why it is called as serratus anterior muscle. Okay, serratus anterior, right? Now, where does serratus anterior originate and where does it insert? So very easy. Let us say that this is your sternum. Let us say this is the sternum here. Okay, and let us also tell that here you have got your first rib, for example, and let us say this is your second rib, this is your third rib, this is your fourth rib, and it goes on, you know, 1 2 3 4 5 6 7 8, all the 8 ribs, they go on like that. And next important thing is that let us move this rib cage aside. Now all of you know that we have got a scapula like this. Okay, we have got a scapula like this, and all of you also know one very important thing, that we have got the superior border, we have got the medial border, we have got the inferior border. So this border is called as the superior, this is called as the medial, and this is called as the inferior border. Okay, now origin of this muscle is from the upper 8 ribs, okay. So you have got the ribs 1 2 3 4 5 6 7 8, and it goes on. From the upper 8 ribs the origin starts. The origin in the sense, look here, some muscle fibers, they get attached to the top of the scapula, onto the superior angle of the scapula. Some muscle fibers attach to the medial border of the scapula like this. Some muscle fibers, they attach to the inferior angle of scapula. So where is the insertion now? What can I write about the insertion? The insertion is to 3 different locations. One is the superior angle of scapula. Okay. Next we have got the medial border of scapula. Okay. And lastly we have got the inferior angle of scapula. So superior angle, medial border, as well as the inferior angle of scapula. Okay, this is the origin and this is the insertion. Okay, now another important thing is that, for example, you know, this scapula is supplied, not scapula, this serratus anterior is supplied by a nerve which comes from the brachial plexus only, because brachial plexus supplies your entire upper rib. So in the brachial plexus you have got roots C5, C6, C7, right? So from the root of C5, C6 and C7, a nerve will come, that is called as long thoracic nerve, and this long thoracic nerve will supply your serratus anterior muscle. Okay. From when I discuss about the brachial plexus, there I will be going on detailed with this. Okay. From C5, C6 and C7, from C5, C6 and C7, you have got a nerve called as long thoracic nerve. Long thoracic nerve, or the other name is that it is also called as nerve of Bell. What is it called as? It is also called as nerve of Bell. Very, 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 very important. This is asked number of times. And where does this long thoracic nerve or the nerve of Bell supply? It supplies to your serratus anterior muscle. It supplies to your serratus anterior muscle. Okay, it supplies to your serratus anterior muscle. And by the way, I am telling you guys, remember this root value, because this root value is very, very important. This root value is very, very important. Multiple times it is asked in the exams as well. So C5, C6, C7 together, they give a long thoracic nerve or the nerve of Bell which supplies your serratus anterior. So if there is damage to this long thoracic nerve, so serratus anterior is present here. If someone gives you a sudden blow, right, sudden blow here, right, a sudden punch, what might happen is that the long thoracic nerve might be compressed and might be damaged. So in that case, the serratus anterior muscle is not supplied by any nerve. So what will happen? This serratus anterior will cause winging of the scapula. Why serratus anterior should cause winging of the scapula? Because the serratus anterior is a muscle which is attached on the top, in the middle and in the bottom to the scapula. So obviously if there is paralysis of this muscle, then scapula cannot be, the attachments cannot be maintained. Scapula will droop down, isn't it? That is why it is called winging of scapula, drooping of scapula, right? So this patient, you can see here, there is winging of the scapula in this picture over here. Okay, so this is called as winging of scapula. This is called as winging of scapula. And again I'm telling you that this question has been asked multiple number of times, guys. Multiple number of times they have asked you this question. Keep this thing in mind. Okay, winging of scapula is serratus anterior. Paralysis of which muscle? Serratus anterior. Palsy of which nerve? Long thoracic nerve or the nerve of Bell. Now nowadays another question also is been asked. You know what is that? Winging of scapula is long thoracic nerve, but partial winging of scapula is by which nerve? That is very important. partial winging of scapula. Partial winging of scapula is because of a nerve called as spinal accessory nerve. That is called as spinal accessory nerve. And where does the spinal accessory nerve innervate? It innervates your trapezius muscle. It innervates your trapezius muscle. Okay, so this box is also equally very important, guys. Very important box. All of you have to keep it in mind at any cost, because multiple times questions have been asked. Okay, simple thing. Winging of scapula, serratus anterior, long thoracic nerve. Partial winging of scapula, spinal accessory nerve, trapezius. That's it. Okay, so these MCQs are really very important. Apart from this, another thing is that there are two ways. Right? So we are discussing all these muscles. In every muscle we are mentioning about the scapula, right? Every muscle we are mentioning about the scapula. So previously there was a question asked, what causes protraction of scapula and what causes retraction of scapula? For example, if I am putting my hands forward like this, right? Now my scapula, both of them, they are bending forward like this. This is called protraction of scapula. For example, if I am stretching my body like this, then both the scapulas are coming towards each other. This is called retraction of scapula. Okay, one is called protraction, one is called retraction. Now, okay, let me write the heading here. One is called protraction of scapula. One is called protraction of scapula. Another one is called as retraction of scapula. Now, which muscle causes protraction of scapula? If scapula is to bend forward, then I have to pull my hand forward like this. I have to keep my hand forward in this way. So when I'm keeping my hand forward like this, that is what causes protraction. Now what is this movement, guys? This is called as a boxing movement. So which is a boxer muscle? Serratus anterior is called as your boxer muscle. So can I tell serratus anterior is helpful for this protraction? That is why you call it as boxer muscle. How? This is how you do boxing, right? So serratus anterior is called as a protractor. You know, serratus anterior is called as a powerful protractor. Okay, so the first muscle is serratus anterior, which is called as a powerful protractor. Serratus anterior is a powerful muscle which causes powerful protraction, right? Powerful protractor. Apart from that, we have got pectoralis major. Pectoralis major muscle. Okay, now when it comes to retraction, how do you remember retraction? Is that R stands for rhomboid. R stands for what? Rhomboid. You have got rhomboid muscle, right? There are two types of rhomboid. All of you know, one is called as the major rhomboid muscle, another one is called as the minor rhomboid muscle. One is major and one is minor. And what is TRA stands for? TRA stands for trapezius. Okay, so there are two types of muscles. One is called as protractors of scapula, another one is called as retractors of scapula. Protraction in the sense pectoralis major and serratus anterior. Okay, retraction in the sense R stands for rhomboid and traction stands for trapezius. So this is how you remember the retractors. Okay, this box is of high important, right? It is very important. So all of you definitely have to keep these box in mind. Definitely, it is very important. So what are the muscles which we have discussed, guys? If we have to discuss the nerve supply, we have to write down the muscles, right? One is called as a pectoralis major, we have discussed. Another one is called as a pectoralis minor, we have discussed. And next, below the clavicle, the muscle name is subclavius, we have told. And finally, I have also told that we have got a muscle called serratus anterior. Serratus anterior. Okay. Now these are the muscles. Now, all of you know what is the nerve supply. If you wanted to know the nerve supply, you should know the alphabets. All of you know L, M, N, O, P, right? L, M, N, O, and it continues down. Okay. What does L stand for, guys? L stands for lateral and medial pectoral nerve. L stands for lateral as well as medial. Obviously pectoral now, because it is supplying the pectoralis. So even for pectoralis minor also there is a nerve named pectoral nerve. Yes, medial pectoral nerve. Medial pectoral nerve. Then what about minor? Minor, M stands for medial pectoral nerve, medial pectoral nerve, and pectoral nerve. Okay, what does N stands for? N stands for nerve to subclavius. Very easy to remember, right? So this is nerve to subclavius, and obviously need not tell this thing because already all of you know what does serratus anterior. All of you know serratus anterior is innervated by long thoracic nerve. Long thoracic nerve. Okay, so this box is very important because a question has been asked from the pectoralis major that what is the root value of lateral pectoral nerve as well as medial pectoral nerve. The root value of lateral pectoral nerve is C5, C6, C7, C5, C6, C7. This is the root value. This is the root value of the lateral pectoral nerve, and after that C8 till T1 is the root value of the medial pectoral nerve. C5, C6, C7, I mean C5 to C7 is the lateral pectoral nerve and C8 to T1 is your medial pectoral nerve. So this is a very important thing, you have to keep it in your mind. Okay. Now apart from this, regarding the pectoral region, we have discussed the muscles, we have discussed their origins and insertions, we have discussed their actions, and we have discussed the nerve supply and the clinical part. In the clinical part, what we have discussed about winging of scapula and partial winging of scapula. Now I am discussing the third clinical point, and that is called as Poland syndrome. That is called as Poland syndrome. You know what is this Poland syndrome, guys? What is this Poland syndrome? Poland syndrome is a genetic condition. Okay. Now in this, what will happen to the patient is that one side, either left or on the right side, the muscles, they don't even develop. Let us say pectoralis major, mostly left side it will be there, right side there is no pectoralis major. These are called as hypoplastic muscles. Okay, it is present always unilaterally, not bilaterally. So this is a picture which you can see that on the left hand side we have got the muscles, but on the right hand side there are no muscles, right? So this is called as unilateral. This condition is called as unilateral chest wall hypoplasia. Unilateral chest wall hypoplasia. So this is a condition called unilateral chest wall hypoplasia. Okay, so mainly which muscle is affected, guys? That is your pectoralis major muscle. That is your pectoralis major muscle. Not only this, these patients, if you look at their hands, guys, if you look at their hands, even there will be, not only this, guys, even in these patients, if you look at their hands also, look at their hands, even the hands are also not developed. There is hypoplasia of the forearm, not only hypoplasia of the muscles of the chest. Even the second important thing is that these patients will also have hypoplasia of hand and forearm. Hand and forearm, if you can see this, right? These are called as shortening of fingers, right? So these are the two important things that are associated with the patients of Poland syndrome.